All right. Hi, everyone. Thank you so much for being on our CNC YP Meetup today. We're going to keep it short and sweet because we have some information we wanted to give you, and we wanted to make sure you were able to share this with your colleagues and your networks. But we know you're busy, and we want to make sure we leave time for the rest of the stuff you have going on in your day. There aren't a ton of people on the webinar live right now, so we did plan to have a little bit of a discussion, but honestly, feel free to chime in at any point throughout the webinar and interject, and if you have questions or ideas or suggestions, that's really why we try to do these things, to get some feedback from you guys at health centers and PCAs. So don't be shy. Right now you are muted, but you can just type a quick note in the chat box, and I'll unmute you all so that you can talk if you want, or if you don't want to talk, I'll just read it from the chat box. So whatever works for you guys, basically. Keeping it informal. So I do want to give a quick shout out to our leader sponsors for Knack this year. The leader sponsors of our Community Health Institute, the CHI, coming up here in August in San Diego, are McKesson, NextGen, BKD, Centene, and Ochin. And they've all been really supportive of our young professional activities, which is really, really nice. And so it's because of them that we're able to offer some new programming at the CHI this year that will be completely free to young professionals. So we're really excited about that. And I do want to introduce our team here at Knack that is working on this young professional stuff. For none of us, this is not our full-time job or even really official part of our job description, but we're really passionate about it. We're really excited to work with some of our peers throughout the country on how we can just continue to sustain professional development in this population and make sure we're connecting with other people who are really passionate about this movement. So, I'm Alex. I work in grassroots advocacy at Knack. I've been here about 4+ years and working on this YP stuff here for a couple of years. And I've got our newest member of the CNC YP team, Shell Lessington, from our research department here. You want to say hi, Shell?
Yeah, hey everyone. Just started here at Knack, was an intern before, and so excited to jump on everything YP and get started. I'm working on the Prepare project right now, and so social determinants of health and data and everything. So nice to be on the call.
And Russell, you want to introduce yourself? I think you might be on mute.
I am on mute. Hi, everyone. My name is Russell Brown. I work for the Clinical Affairs Division here at Knack as a C2C portfolio manager. Been with the YP folks like Alex and Liz since the startup of us doing things at conferences and stuff. So really excited to have you all on the call today, and we're looking forward to CHI in the future in a few weeks or so. So yeah, thanks.
Thanks. And Liz is from our Training and Technical Assistance Department. She couldn't be on the call today, but she is helping out with our CHI activities as well. So there's our info. Take a screenshot if you want to save that if you don't already have it. You can always reach out to any of us individually or email chcyp@knack.org if you want to just kind of generically reach us with your YP questions. So why the YP track? So why are we doing this stuff? Basically, I mean, you guys are on the line because you're interested, so therefore you already know. But when I started here at Knack, we had a reception at our Meetup Knack conferences where YPs could get together and, kind of have a happy hour, have some apps, talk. Sometimes we have a speaker, and it was a really nice opportunity to get to know people, but there wasn't a ton of structure to it. It wasn't a great opportunity to have a little bit of a deeper conversation about, professional development in this movement, how you grow your leadership skills, how you connect with mentors, where you see yourself going over the next 10, 20, 30 years. Do you see yourself staying in this movement? So we thought, we should have a little bit more structure and more opportunities for young professionals to kind of come together, really get to know each other on a deeper level and become friends, and also learn together about, major healthcare trends and major issues going on in community health right now so that you can work to build your portfolio to be more robust and more competitive as we try to lead this movement forward. So So that's why, and actually one of our fellow young professionals at a health center up in New York likes to say, like, all the people, that are kind of leading this movement right now, they've been around forever, they've been around since the start, they know the struggle, they know the success, and they know each other really well, they're really friends. And so we want to kind of form that, within our cohort, be able to share those stories, those struggles, those successes, and just have a great friendship network that goes beyond, just your organization. And we get a ton of questions all the time, so I always try to include a little piece about this, like, who is a young professional? And I actually had somebody recently say to me, she was laughing because she's learning this too. Somebody said to me recently, like, well, I'm not young, but I want to be, I'm a professional. Like, I want to be concluded in this stuff. And I was like, okay, yeah, but this is really for young professionals, and I'm not going to fall into the trap of putting an age on what it means to be young, because I don't know what that means to you. If you feel like you're not young, then, I don't know, come ask us. But I think, if you're drawn to this track, if you're drawn to the content of it, if you feel like it's really important for you to connect with people in this movement that are, not necessarily CEOs, they're not necessarily at the top of their organizations, but they're interested in growing, they're ambitious, they're hungry to learn, I feel like then you are considered a young professional, and so we want you to be involved and included in what's going on. We've had people come to young professional events, honestly, that are in their 70s and people who are in their early 20s. And it really is just about this movement of people who are really just getting started in the health center world. Maybe you've been there for 10 years, but you're still kind of like learning the ropes and trying to figure out what your career path is going to take. But the older people that are there, I think, are there to support this generation who is hopefully going to rise in the ranks and be the next leaders, once this cohort of health center leaders, begins retiring. So all that to say, we're keeping it broad for now. For those of you who want a more specific definition, I'm really sorry. But I think, whoever is really drawn to this stuff is definitely welcome. We want to keep it as inclusive as possible. And I meant to change the slides here, so I'm just going to thumb through real quick. So I want to talk about our first event that we're going to be doing at CHI, and this is completely new for us, so we hope you'll bear with us and help us through this process, because I think it'll be really fun, but it's completely different. And then I'll turn it over to Russell to talk about some of the stuff that we've been doing for a while now that we are going to continue with. So the CNC YP Hackathon is our first ever hackathon, and I have a bunch of text here, but basically when we did our first track at CHI last year for the young professionals, somebody wrote in the evaluation, I think you guys should do a health hack, and I was like, I don't know what you mean by that, but that sounds cool. So I started doing some Googling and finding a bunch of organizations that are taking this sort of technical hackathon model, which if you guys have never heard of, basically a bunch of coders getting together in a room. Sometimes they stay up all night working on producing an app or a website or some sort of solution to a really large problem. And, usually they eat a lot of candy and have Red Bull and stuff. And then by the end, they produce this product that they can then present. And there's a lot of organizations right now that are taking that model and making it not technical. So it's taking all of the brain trust in the room, all the skills, all the talent and interest, and turning it into a solution to some sort of broad problem. So we thought that was a really good way to engage young professionals, so you can be committed to growing different parts of your skill set, but also looking with an eye to the future of the health center movement as we work together to solve some of our biggest issues. And we thought it was a good opportunity also to include some of our current health center leaders into the mix. So some of those people that are CEOs now, or they've been around for years and years, and they've done amazing things in their communities and brought new services and new access to care in some, the most remote parts of our country or most difficult to serve. And so we wanted to bring those people in and to help guide some of this conversation. So not only are we giving young professionals the opportunity to network and get to know each other, but also to build from the successes and challenges and struggles of our current generation of health center leaders. So really excited about this, guys. I think it'll be cool. If you've been at a CHI track before and you've seen that we do young professional speed networking and a bring your passion session, this is going to incorporate both of those things as well as some more of that project work. And by the end, you'll be with a group. You'll produce a presentation with a specific solution to an issue, and it's something to add to your resume, and I think it's a really cool thing that you can take back to your organization. We are limited to 35 individuals for space purposes, and we'll have some food and coffee and stuff. So I would definitely register as soon as possible. It is free to register, which is awesome. Thank you to our sponsors. And it's going to take place on Saturday at CHI at the Manchester Grand Hyatt, which is the conference hotel in San Diego, from 2 to 8 p.m. It's actually a pretty short hackathon, but we were like, let's start small and we'll see how it goes. Really encourage you guys. I mean, there's still space to like send this out to your colleagues in your networks that you think might be interested. Tweet about it, share it, because I think it'll be a cool event, and we want you guys to be there. So I'll turn it over to Russell now to talk about the rest of the CHI stuff.
Perfect. I'm just going to move a little presenter ball. Oh, you can. There we go. Awesome. So for those of you who have yet to been a part of our track, we typically try to tailor our sessions across all sectors of Knack. So we have a lot of different divisions, and so this year's track is going to highlight some aspects of advocacy. It's going to be highlighting some things in clinical, and it's also going to be highlighting some broader things around training, technical assistance, and population health. So it's a really exciting track, and it kicks off on the first day of education sessions, which is that Monday. Let me just pull up the track right now. Okay, so it's comprehensive, and you'll get a sense of a lot of current policy environment, but also what's going on operationally and clinically, which I think is really great as well to kind of round out your education that you'll be getting at CHI. And also, there'll be a lot of intergenerational, as Alex is alluding to. We do get a lot of people who attend the YP track that are not necessarily in your typical category, but they do support YP efforts. And so you'll get a chance to network with them and be a part of that track, kind of like a little cohort that's going from the start to the finish at this educational conference. So we do have a link in these slides. And also, if you just go to our website, you can look at this. It's called the Educational Sessions at a Glance. And so in that document or the PDF of it, it essentially will the YP track is actually highlighted as this beige kind of yellowy color. And so those are the specific sessions that we have outlined for you all related to YP development. So we'll talk about that in a little bit. Great. So just to give you kind of an overview of the YP track, it starts off bright and early at 8 o'clock on Monday morning with population health improvement projects, lessons learned from the field. So population health is obviously not a new thing that everyone should know about, but it's something that is really kind of gaining a lot of ground in the community health center work because it focuses on specific populations like people with injection drug use issues or substance abuse or comorbidities related to diabetes or HIV or things like that. So population health improvement projects, you'll learn a lot about how these people implemented them, because typically we found out that young professionals who are in the midpoint of their careers, they're more of the implementers and the designers. So this might be really good to take some tips and practices from that session. It's going to be a really exciting session, even though it's 8 o'clock in the morning, because there's going to be some amazing speakers that I had the chance to speak with thus far. So the next session is that afternoon from 1:30 to 3, and that is learning from the pros, advocacy best practices, and I'm sure Alex can delve into that a little bit. Alex, did you have anything to say, or just to highlight some general big themes?
Yeah, totally. So best practices panel for advocacy this year is going to compromise different areas of grassroots and grasstops advocacy. So we'll be talking a little bit about how you can engage special populations in advocacy. We'll be talking about using online online different methods for advocacy, particularly social media. And we'll also be talking just generally about how you can be an advocacy leader at your organization and really kind of rally the troops. We chose this session for the YP track because there is so much going on right now that requires our advocacy for health centers, and it's just a good skill to have, I think. I mean, I'm a little biased because I work in the advocacy department, but it's a good skill to have for whatever issue you're trying to rally people around in your area.
Yep. So then followed right after that, there between 3:30 and 5, which is pretty much the end of Monday in terms of educational sessions, we have the federal legislative update, so the latest from Capitol Hill. So as Alex is alluding to, the political environment right now is very fluid, and so a lot of things are happening, and there's a lot of really interesting things going on in the Capitol. And so to be abreast of those conversations and to be on top of that and to know what Knack and other people who are advocates are doing about it, I think that would be a really great introduction to really, grounding yourself in more policy aspects, but also just grounding yourself about what is the fight and what is happening in terms of, community health centers and healthcare overall. So I think that's going to be a great session, kind of a rousing call to arms, if you will. I think that's what I think it's going to be. But so, yeah, Alex, do you have anything to add to that? I think that's kind of the general consensus for the federal health.
Yeah, no, yeah, you're right. I think it's definitely going to be important, and there's obviously healthcare legislation that's, maybe dead right now. We'll see. And then we have a big funding cliff coming up soon. So there's just a lot of policy issues to be keeping our eyes on. This will be federal focused, but certainly a good opportunity for you to get plugged in, if you're not already, into some of the important stuff that could be impacting health centers pretty soon.
Perfect. And so I believe on that night, just to orient myself, even though it's not a part of the educational sessions itself, it is a part of, it's a great way to just do some basic, actually, sorry, that's on Sunday, August. But so one thing I forgot to mention is that outside of our educational sessions in the hackathon, there is a normal reception that we do every single annual conference, so P&I and CHI. So this year, just to keep up with the theme that we've been having, which is typically the young professionals receptions are off-site. This year it's going to be at Seasons 52, which I heard is pretty close to where the hotel is. It's a little short walk. But I heard that the location is fairly decent, and there is a link on the website, on the Knack's website for the CHI, under the Young Professionals track that will show you what Season 52 looks like and the food choices and things like that. But it's a great time to come out, and I believe that is on Sunday. That's what it says on the website, so that's what I'm going to go by. So that's the night before the educational sessions start. So just to hop back and forth between that. So then back to the actual track. So then Tuesday, which is the last day of educational sessions, we start off at 8:30 in the morning, nice and early, with leveraging community health workers to provide care coordination and enabling services. So this is hosted by our TTNA, our Training and Technical Assistance folks. And so what I gather from this session is that it's really going to be utilizing expanding care teams, specifically community health workers, to really do that complex care coordination and also some of those enabling services that providers and other, medical people, clinical people cannot necessarily do during their average day because they're seeing patients. So it's really how to utilize your full staff to their full credentialing and really, improving the health care that your patients are receiving at your health center. And then last but not least is the last session, which is from 1:30 to 3. And this is called Assessing a Diverse Multi-Generational Workforce for Inclusion and Differentiated Learning. So that title, after talking with the session leads, was a lot longer than what it is now. But basically what it sums up to is the environment. Millennials are obviously going to outgrow baby boomers and things like that in the next 5 or 10 years in terms of workforce. So how do you utilize, how do you make sure that your work environment is conducive to both of those populations and everything in between? So it's really coming from a diversity approach and really talking about how to enhance that environment so everyone is learning across all ages, genders, races, ethnicities, et cetera. And then on top of that, it's going to be talking about utilizing some sort of, some resources that help sort of bridge that divide and make it easier for those people to really work at the health center. So I think this is a great session after speaking with the speakers and also the session leads for it, that it really is kind of what YP is about utilizing your resources, your information, and spreading that to your health center and really working with your cohort and your coworkers. So yeah, that pretty much sums up what the track is, and we're really, really excited about this because they're all really well thought out, and they're going to be, I hope they're all going to be executed perfectly. So yeah, I think that pretty much covers what I was supposed to talk about in terms of the track. So going forward, some of you on this call are potentially a part of our CHC, the Young Professionals groups that we have on LinkedIn. So we do some postings there. We're trying to get more content so we can post it, but that's a good place to get more information about CHI. If we're doing any blogs or upcoming like social media kind of rushes or things like that, we'll be posting them on there as well. So feel free to try to join the group. It's Knack's CHC Young Professional Group, and then Alex or myself or Shell will soon be invited herself as a manager. Will be able to approve you and let you into the group. And so feel free to post things that you find that are related to young professional development or professional development in general that will be beneficial for everyone. So yes, so we have a bunch of different ways to communicate. LinkedIn is one, Facebook and Twitter. Knack, it does have a Facebook and a Twitter account and also a LinkedIn account, and we are, as YPs, we also have a LinkedIn account as well that I just went over. Spread the word online, invite your colleagues. I know Alex said this at the beginning. It's really about building that network, because if you remember hearing any of the old guard of the health center movement, it really was just the connections that they made across the United States. So invite your colleagues, tell them to invite theirs, and hopefully the word of mouth will really highlight this track at CHI, but also the hackathon, which is brand new. And then stay connected and share your feedback. That is one of the most important things. Send out emails to people, ask questions to us. We're very open, and we love, hearing things from the field. Oh, I forgot to mention hashtags. So CHCYP is our official hashtag. Additionally, we do have a young professional email address for Knack. It's called chcyp@knack.com. So feel free to email that, and all four of us will have access to that email. And then Knack, even though this is PNI, they haven't released the official Twitter yet, but I'm assuming it's going to be Knack CHI 17. Or something, some iteration of that. Alex, do you have any information about that, the hashtags? Because I know that you're in advocacy and stuff. So.
Yeah, it should be Knack CHI 17. That's what I just put in the chat box. I don't think it's being used that much lately. It should be a little bit closer to the event. And right now, I will say, because Health Center Week is coming up, and hopefully you guys are all promoting that, you can use NHCW 17. That's the hashtag we're really pushing right now. But obviously anything with young professionals, and as you guys post and share this stuff, it really helps us to have some stats on the numbers for CHC YP. So the more you use it, the more grateful we will be.
Yep. Perfect. And so to close things out, this is our official logo that we created with kind of everyone kind of came together and created it with our media department and communications department. And so, like I said earlier, there's our email address, our official email address, but all of our email addresses are listed on the website, but we do have this one email address so we can track conversations, emails, and things like that more easily. Alex, do you have any final words? Otherwise, I think we pretty much covered everything.
Yeah, no, we did. We did a speed run. Any questions from anybody that's on the webinar? Go through the chat then. not seen any so far, but I really appreciate your time, and we'll keep blasting this stuff out, and if you can just help us share it and spread the word, and definitely be in touch. You know, if we're not going to see you at CHI, be in touch before then and let us know what your thoughts are about our plans and what other stuff you think would be really helpful to connect the young professionals here.
Perfect. So thank you, everyone, for being on the call. I'm just going to wait a couple more seconds to see if any questions do pop up. So thank you so much for being on today. We're really excited about this. I know I'm not speaking for Alex and Shell, but I'm sure they're going to have pretty much the same sentiment, is that this is going to be great work, and we hopefully will have a lot of great insights from that hackathon, and that we also continue the great track that we did last year at CHI and this past P&I as well. So thank you all, and I think that pretty much sums it up. So everyone have a great day.